Hello guys, good evening everyone. So in this video you are going to see the remaining important multiple choice questions from the respiratory system. So the first question is complication of bronchectasis. So what is the complication of bronchectasis? Options are cerebral abscess, lung abscess, amyloidosis and all of the above. So, in the case of bronchectasis, the person can have the cerebral abscess and the lung abscess and amyloidosis also the present in the case of bronchectasis. So, the right option is option D. Option D is the right answer. The next question is findings in bronchectasis. So, what is the clinical features we can see when the patient is having bronchectasis? Options are barrel chest, rails, stridor, and hyperapnea. The right one is barrel chest. So, barrel chest is a character we can see in the bronchectasis and also in the case of emphysema. Okay, so in the case of emphysema, we can see a barrel chest. The next one is which ventilator mode best for respiratory arrest patient? So when the patient is having a respiratory arrest and which mode is better for that patient? Options are continuous positive airway pressure, option B continuous mandatory ventilation, option C assistant controlled mandatory ventilation, non-invasive positive pressure ventilation. The right one is option B, that is continuous mandatory ventilation. So the ventilator will give a continuous the needed oxygen supply for the patient. That is continuous mandatory ventilation mode. The next one is croup is. So what is the meaning of croup? Options are swelling of tracheal mucosa, option B necrosis of the larynx, option C swelling of epiglottitis and laryngitis. So the epiglottis is when it is infected with the bacteria and virus, it is called epiglottitis and laryngitis. So swelling of epiglottis and laryngitis. Option D nasal airway obstruction. So the right one is option C. So option C is the swelling of epiglottis with the infection and laryngitis. So that is called croup. The next one is smoking can cause for. Options are infection, hypotension, pneumonia, cardiac dysrhythmias. The right one is pneumonia. So commonly we heard that the smoking can cause for the cancer. Of course, it is a leading cause for the cancer, that is smoking. Before that, the person can have the other infections like pneumonia. So in these options, you may confuse that smoking can cause for the cancer. So how can it is cause for the pneumonia? But here you have to see the only options. Okay. So among the options, which is the related to the question, you have to choose that answer. Okay. The next one is ventilator associated pneumonia develops. So when the patient is having a ventilator assistant and if the pneumonia is developed, if the ventilator is kept for the patient, how many hours? Options are 12 hours, 24 hours, 36 hours and 48 hours. So the right one is 48 hours. So when the patient is having a continuous ventilator assisting breathing, I mean that is when they attach it to the patient with the ventilator, if it is more than the 48 hours, the patient may have risk for the ventilator associated pneumonia. Okay, so among the pneumonia, we have the other type, that is ventilator associated. Why? Because due to the continuous attachment of the ventilator with the patient, the patient can have the development of pneumonia. It is called ventilator associated pneumonia. That's it. The next one is pink piffers known as. So what is pink piffer? Options are COPD, that is nothing but chronic obstructive pulmonary disease. Option B, ARDS, acute respiratory distress syndrome. Option C, COB, continuous obstruction breathing, and emphysema. The right one is emphysema. So pink puffer can see in the chest X-ray in the case of emphysema. So this is the right answer. Option D is the right answer. The next one is management for pleural effusion. So what is pleural effusion? Pleural effusion is nothing but accumulation of fluid in the pleural cavity. So pleural cavity is nothing but the layers which covers the lungs. Okay, that is called pleural cavity. So when the fluid accumulation of fluid excessive more than the normal, it is called pleural effusion. So what is the a better management for the pleural effusions? Options are paracentesis, thoracentesis, LP, ventriculopleural shunt. So the right one is thoracentesis. So thoracentesis is nothing but collecting of pleural fluid from the pleural cavity. The next one is principles used for the closed chest drainage. Options are gravity, positive pressure and suction, gravity, negative pressure and suction, ambulation, or posture. The right one is option B, gravity, negative pressure, and suction. So, based on these three principles, the chest drainage is working. Okay, so gravity is nothing but the fluid will come from above to below, and a negative pressure, it is like a suction, and the suction is a manual suction. So, the right one is option B. The next question is, how do you know that the intercostal drainage is working? Options are continuous bubbling in the water seal bottle, continuous bubbling from the suction tube, oscillation of water column in drainage bottle, no bubbling in the drainage bottle. So the right one is option C. Option C is the oscillation of water column. Means when the patient is taking breathing, okay, exhalation and inhalation, what will happen? The water level is changing in the drainage bottle. So it means the intercostal drainage is working. The next one is clinical feature of pulmonary embolism. Options are tachycardia, tachypnea, cyanosis, and sweating. The right one is tachypnea. Okay, tachypnea is nothing but increasing of breath, that is normal, more than the normal. So that is called tachypnea. So in the case of pulmonary embolism, we can see the tachypnea in the patient. So pulmonary embolism is nothing but in the lungs there is a lodging of any emboli. It may be the fat emboli, or it may be the platelet aggregation. So whatever it may be, it is nothing but a clot. So next one is Ghon's foci seen in. Options are rheumatic fever, measles, renal tumor, TB. The right one is option D. TB is nothing but tuberculosis. So in the case of the patient with the tuberculosis, we can see gowns foci in the chest X-ray. The next one is, which drug can cause for the deafness in TB therapy? Options are ethambutol, isoniazid, rifampicin, streptomycin. The right one is streptomycin. So, a prolonged usage of streptomycin when the patient with a positive tuberculosis, so the person can have the risk for the deafness. So we will see some of the adverse effects of TB drugs. The first one is ethambutol is cause for the visual problems, and next one is isoniazid is cause for the peripheral neuropathy, and rifampicin is a red color urine. Okay, red color is nothing but blood color. Blood color urine we can see in the case of rifampicin usage, and streptomycin is cause for the deafness. The next one is Monday fever, also known as. Options are asbestosis, bicinosis, silicosis, and anthracosis. The right one is bicinosis. So, in the disease of bicinosis, the other name is Monday fever. So, we will see some of the occupational diseases and causes. The first one is bagosis. So bagosis is caused due to the sugarcane dust. And the next one is a brown lung disease. It's caused for the cotton dust. And the next one is former lung disease. It is due to the grain dust. And siderosis, it is a iron dust. And also snowstorm appearance we can see in the chest X-ray. Okay, snowstorm appearance in the chest X-ray in the condition of siderosis. So siderosis is due to the iron dust. And the next one is anthracosis. It is a coal dust, and it is also known as black lung disease. So the next two are barytosis is a barium inhalation. Okay, barytosis, it is due to the barium inhalation, and chalicosis is due to the stone dust. Okay, due to the stone dust, the person can have the chalicosis. These are the two new words, barytosis and chalicosis. So this is end of my class, guys. Thank you for watching. I hope you all understand and you prepare for the exams. So the exams may be conducted in the month of May, not exactly, but we are waiting for the exam date. I hope all the very best for everyone. Be prepared and don't neglect the classes. Okay.